Hi, practicing in Australia after BDS is the topic of today's video. It is a part of a series of videos about abroad options after BDS. If you're interested, stay tuned. Hi, I'm Dr. Satish Kumar and this is Kaizen Dental. Our aim here is to help dentists succeed. In today's video, we're going to talk in detail about the process of practicing in Australia after BDS. So, the first step if you want to practice in Australia is to get your documents assessed. The list of documents which you need to send to the ADC or the Australian Dental Council include your degree certificate, your internship completion certificate, if you have any experience or had a practice of your own, details and proof of the same, your registration certificate, your current registration payment receipt, if you have changed your name, details about that, a colored copy of your passport, 2 references from other dentists stating that you are efficient in practicing dentistry, as well as photographs. If these documents are in any language other than English, you need to get it translated by an authorized translator. All these documents also need to be attested. Remember, you need to send only colored photocopies of the same. If you send them your original documents, in case they get misplaced, ADC is not responsible for them. And when you ask for your original documents back, you will have to pay a fee of 85 Australian dollars. All these documents have to be attested. The person attesting address and contact details should be mentioned as well, in case they want to contact him. The entire process of initial assessment takes approximately 8 weeks. This is not considering the time that if you have not submitted a document, you will have to resubmit it. That would again increase the time frame of the entire process. It would cost you a total of 610 Australian dollars. Once you submit your documents, if there are certain discrepancies, you have within a year to submit all the exact documents required. Once your entire initial assessment is over, the assessment is valid for a period of 7 years. Then, once your assessment is done, you get into the theory examination part. The theory examination is conducted by Pearson VUE. It's an online computer-based examination with centers all across the world. You can give it in India itself. After you decide Australia is a place you want to be, you can go to the ADC website and check out the various centers they have. The theory examination consists of 4 papers and 2 days. In the first day you will be giving paper 1 and 2, and in the second day paper 3 and 4. Each paper consists of 80 scenario-based multiple choice questions. You have to individually pass each of these examinations to clear the theory part. Paper 1 consists of dental caries, dental pulp, dental materials, tooth conservation and endodontics. Paper 2 consists of removable prosthodontics, fixed prosthodontics and implantology. Paper 3 consists of oral medicine, oral pathology, oral and maxillofacial surgery, pharmacology, infection control and anesthesia and resuscitation. Paper 4 consists of orthodontics, radiology, preventive dentistry, pediatric dentistry, public health dentistry and periodontics. You are given grades which are A to E. A, B, C means you have passed the examination. If you get a grade of D or E, you have failed the examination. The entire theory examination would cost you 2000 Australian dollars for every attempt. Before you give your practical examination, you have to give your IELTS, that is your International English Language Testing System examination, and score more than 7 in each section. Before we move on to the practical examination, I hope you're getting at least 1 point from today's video. If you have, do not forget to hit the like button below. And I'm sure you're subscribed to our channel because we keep posting career options and career growth ideas after dentistry. If you're not subscribed, do subscribe right now. Then comes your practical examination. It is conducted in Melbourne, Australia, with the Australian Dental Council having their own centre. This means they can conduct an examination every week except in December and January. So you would get approximately 5 to 6 attempts every year, and you have to clear the practical examination within 3 years of clearing your theory part. The practical examination is held across 2 days. One day would be your technical examination and the other your clinical skills. In technical examination, it is divided into 3 clusters: the conservative cluster, the endodontics cluster, and the prosthodontics cluster. In the endodontics cluster, you are expected to prepare access cavities or other endodontic steps on diaphodonts in dental mannequins. In the prosthodontic cluster, you are expected to prepare teeth for getting indirect restorations. That is basically your crown preparations. You might also be asked to temporize those preparations. Then comes your conservative cluster. In that, you would be asked to prepare teeth to receive silver amalgam or composite restorations, or you will be asked to do silver amalgam or composite restorations in pre-prepared teeth. The clinical skill examination is based on the OSCE pattern, that is the Objective Structured Clinical Examination. Once you enter the examination day, there would be 10 different rooms or compartments, each having a task to be performed. You would be given 2 minutes initially to understand the question and 10 minutes to perform the task. Usually there are 6 communication skill based tasks, which include taking a case history, explaining a treatment to a given patient, risk assessment or profile of the patient, and so on. The technical part would include procedures like placement of rubber dam, taking a dental radiograph, or performing a CPR. A maximum of 24 students are taken for the practical examination. They are divided into 2 batches of 12 each, with the first 12 giving the technical skill examination on the first day and the clinical skill examination on the second day, the remaining 12 having a reverse order of examination. You would be graded based on each skill you perform, with scores of 0 to 4. They also have a grading pattern stating whether you did the given task outstanding to something known as bad fail. If you get a bad fail in any task, it means you didn't do it well. Hence, you would fail the entire examination. Each examination attempt would cost you 4,500 Australian dollars. Before you decide whether Australia is a place you want to settle in and practice dentistry, do not forget to check out all our videos about the various abroad options after BDS. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed.